this evening, our topic is healthy aging. Health, as defined by the World Health Organization, is a state of complete physical, mental, and social well-being, and not necessarily the absence of disease, disability, illness, or infirmity. This means that one can be affected with a chronic illness. You can be living with a chronic illness and still be considered relatively healthy. Aging is the process of time-related changes that encompasses our physical, mental, social, sexual, and lifestyle functions required for our survival and reproduction. Most changes of mid to late adulthood usually occurs between ages 40 and 60. Aging is a long and complicated process. And there are 5 stages of aging. Right. So the 5 stages of aging, most of us are in the self-sufficiency stage, where we are entirely self-reliant. We are able to live independently and complete activities of daily living without any difficulty or safety issues, such as our self-care or hygienic needs or performing household chores. The next stage of aging is interdependence, where we may still be able to live alone and can complete most, if not all, of our activities of daily living independently, but require some degree of support and assistance from either family or friends. Home modifications may be required. We may not be able to drive safely. We may require some assistance with transportation, completing tasks, or running errands due to health conditions. There may be slight cognitive decline or memory loss, which is expected. The difficulty in accepting any loss of independence is the main cause of stress, anxiety, and depression at this stage. A sudden medical emergency may cause unexpected progression to the next stage, called dependence. Dependence is where we can no longer live on our own safely based on cognitive decline or health problems. These may prevent us from completing activities of daily living, and care by a personal support worker or PSW or a home health aide may be required. The next stage is crisis management, where we require medical support, immediate medical support. Some of us after this stage may require professional care at home or at a care facilities, which has its own challenges as well as benefits. Given that there is on-hand medical attention, some assistance with our care, as well as interacting with other persons, which may benefit our socialization. And the last stage of life is end of life, where we are nearing our final days. Some of us may choose to discontinue receiving medical care and enter hospice care. The goal at this stage of life is to be as comfortable as possible, especially if we're diagnosed with a terminal illness such as cancer. I want to encourage us all to always remember that acceptance of this stage can be difficult, but the process of aging is a natural part of life with very meaningful moments at every stage. There are 3 facets of aging. We age in 3 different ways. We first age physiologically or physically. And physical aging happens to all of us. It affects areas such as our vision, hearing, sleep pattern, digestion, posture, or shape. It changes the way we look, the way we're able to move, as well as our sexual and reproductive functions. Physiological aging is related to brain changes or changes in our thought processes that may affect our problem solving, our emotions, or our reaction to situations. And social aging includes our role in society as well as among our peers and even in our families. We may find that being the leader of the family, the matriarch or the patriarch, our children and grandchildren are now making decisions for our care and how things go. This is definitely based on what is expected of our behavior, based on our personality and habits. So if Keldo, who is normally an energetic person, starts behaving very withdrawn or doing things differently, it is a cause for concern because people are used to you having a certain personality for most of your life. And usually at this stage, things may change based on your cognitive function, your physical health, as well as your inability to accept the stage of life that you're at. Physically, our bodies naturally change with age. If there's anyone in this group whose body has not changed over the past 10 to 20 years, please raise your hand. I want to know exactly who you are and what your secret is. In terms of our brain function, there is a normal decline in our cognitive ability, our ability to think and process and perceive certain things. And this is associated with changes in our brain. What we have noted though is that physical activity, exercise, walking, stretching, cognitive training, such as reading a newspaper, keeping up to date with current events and what's happening, socializing with peers, helps to preserve brain function as well as our memory. Parkinson's disease affects approximately 1% of persons over the age of 50. This is basically 1 in 10 persons. And it is characterized by tremors, a kneading motion when we're kneading dough. That same motion is when our hands shake and move. We may lose balance. We may have poor coordination. We may become very rigid and have difficulty moving. Family history, a history of brain injury, industrial chemical exposure, such as prolonged exposure to carbon monoxide, such in the case of mechanics, or pesticides, this may be the case with farmers, puts us most at risk. Treatment mainly improves our ability to move, but in terms of the decline, it usually is progressive. Our sleep pattern changes as we age. We tend to go to sleep earlier and wake up earlier. We may experience insomnia where we have trouble falling asleep, or if we do fall asleep, we have trouble staying asleep. We may wake up many times during the night. We may wonder when we're up, or some persons actually yell throughout their sleep. All of this reduces the amount of restful sleep that we're able to get. It increases our risk for accidents and falls, as well as chronic fatigue, where we're feeling constantly tired. It reduces our immune function. So we find that if we're having difficulty sleeping, we may end up getting the cold or flu more often. And it may also lead to depression because we're constantly feeling tired, and tiredness actually affects our mood. Sleep apnea is characterized by repeated pauses in our breathing as we sleep. Many persons are affected with sleep apnea even before the age of 40. It usually affects persons who are overweight, and snoring is a common sign of sleep apnea, which actually worsens with age. If untreated, sleep apnea impairs how we function during the day. It may cause high blood pressure, headaches, stroke, and memory loss based on the level of oxygen and the constant drop. Restless leg syndrome is a tingling, crawling, or pins and needles sensation to either one or both legs, which is usually worse at night. And this is something that some persons may develop over a period of time that they never had before. Periodic limb movement disorder causes a jerking or kicking movement every 20 to 40 seconds while we're asleep, and this too worsens with age. In terms of our height and weight, after age 40, we lose approximately ½ an inch in height every 10 years. And this increases at age 70. We usually get shorter and shorter. A total of 1 to 3 inches in height is usually lost with aging. Weight gain occurs up to ages 55 for men and ages 65 for women. And then it's followed by weight loss. And this is usually related to loss of muscles. Fat usually builds up around the midsection of our bodies. Most of us will just pop like a popcorn and explode. In terms of our hair, skin, and nails.
Say that again.
What did you that?
I missed about popping like a popcorn.
The popping like a popcorn refers to our weight gain. It usually occurs, men up to age 55 will start to find that they're putting on weight. And women, we continue gaining weight up to age 65. And then after 65, we usually go over the hill and start losing weight due to loss of muscles. But most of our weight stays around our midsection. So our tummies will blow up. It will just get bigger than other parts of our bodies. Hair loss is common as we age, and the rate of hair loss, the rate of hair growth actually slows down. So our hair doesn't grow as fast as it did when we were younger. We have loss of pigmentation, which results in our hair graying. Facial hair gets coarser. Many of us have hair on our chin and above our lips, and that gets coarser for women. And for men, hair gets longer on the eyebrows, in the ear, and in the nose. Our skin becomes thinner, less elastic, and no longer looks plump and smooth. Our veins and bones become more prominent. We bruise easier, and cuts take longer to heal. Gravity causes our skin to sag. With a decreased production of natural oils, our skin becomes drier with fine lines, wrinkles, and a dull, uneven skin tone. There's also age spots. We have visible pores and small growths called skin tags. A lot of women during menopause, which we will talk about later, experience something called melasma, which is a darkening of the skin, and it may happen around the eyes, it may happen under the eyes, or be blotchy on the face. It can be very frustrating because you're taking care of yourselves and then you see these spots. These are spots that actually are hormonal, and they affect some women during pregnancy as well. It can be treated though, and we'll discuss this further a little later on. Our nails become harder and thicker with development of vertical lengthwise ridges. So we'll start seeing lines in our fingernails that weren't there before. Our vision, our eyes become drier, making it more difficult to see in dim lighting. Colors are less vibrant, and the need for glasses increase. There are eye moisturizers that are available over the counter. One that I use is Sustain. Sometimes your eyes feel very scratchy, very dry, very irritated. It's because it's dry. It's no longer producing as much tears as before. And 1 or 2 drops of those drops makes things feel much better. Cataracts or cloudy discoloration of the eyelids usually develop for many of us by age 60. 70% of us by age 75. And cataracts interfere with our ability to distinguish colors. Besides age, risk factors such as diabetes, hypertension, obesity, smoking, prolonged exposure to the sun, and a family history are contributing factors. Treatment involves surgical removal of the lens or natural lens and replacement with synthetic ones, and they usually work. Glaucoma, which is also common, begins as a loss of peripheral vision, not being able to see clearly on the sides. Side vision, it's called, due to a buildup of fluid in the eye, which increases eye pressure. This results in damage to the optic nerve or the main nerve in the eye. As glaucoma advances, there is loss of vision, and this loss of vision is complete. It is irreversible. Many persons, treatment, the eye drops that doctors may give slow the progression or decrease eye pressure, But over time, persons will definitely go completely blind. And this, so far as we know, is irreversible. There is no cure for glaucoma, but the rate of progression can be slowed with early diagnosis and treatment to reduce pressure. And that's why it's so important for us to see the eye doctor at least once a year to see if there's any changes and how it can be reversed or slowed down. Our hearing or auditory system, or the system comprising of our ears connected to the brain, enables us to hear well as maintain our balance. Aging causes a decline in sound frequencies that we can detect and the intensity of sound needed to hear. The Canadian Hearing Society estimates that 60% of persons over the age of 65 has hearing loss. Presbycusis is a gradual hearing loss that occurs in late adulthood. It usually runs in families and affects hearing in both ears. Therefore, it is important to see a doctor if we notice any changes, such as having to ask someone to repeat themselves or multiple persons to repeat themselves, or we have difficulty hearing over background noise. So there may be music in the background, there may be a sound and at work that's loud, probably machinery, and we're unable to hear when people speak, even though they're shouting, and can be heard by someone else with good hearing. If we see the doctor, the cause and treatment can then be determined, and hearing aids can be prescribed, or lifestyle changes. For some of us, it may mean reducing the volume of the noise that we're experiencing, wearing earplugs. There's so many ways that we can change our lifestyles to prevent further hearing loss. Tinnitus is a ringing, hissing, or roaring sounds in the ears that may occur. The cause is unknown, but we've found that most persons who are living with hypertension or who may have allergies usually complain of this problem. It may come and go, it may persist and get worse over time. With age, there is a decline in inner ear function, which may lead to problems with balance. So we may feel unsteady while we're sitting, standing, or moving. And this in and of itself can be treated. In terms of taste and smell, by age 50, we gradually start losing taste buds, which become more apparent by age 60, related to loss of smell. Loss of smell is more common in men, with about 1 in 4 as compared to 1 in 10 women. Loss of smell can cause dietary changes, because if you can't smell the flavor of the food, it's not going to cause your mouth to water and want you to eat as much, or probably eat at all. We are not able to enjoy the food as much, and then we end up not eating enough for a balanced nutrition. And we may find ourselves adding more sugar or salt to the food, which in and of itself may lead to diabetes, hypertension, and all of that stuff that's not so good. Our teeth and gum disease, sensitive teeth or dry mouth may develop related to medical conditions such as diabetes or heart disease. Regular dental checkups are therefore important. And if care of our oral health or mouth care is affected or is difficult because of conditions such as arthritis or anything that affects our dexterity, we can change the type of toothbrush. Most persons are using the automatic or spinning brush. So they just hold it, they're able to hold it and get their teeth clean in a proper way without much effort. We're advised to avoid smoking, which can actually increase our risk of tooth loss as well as mouth cancer. Loss of smell and taste, as was said before, as well as tooth loss, can affect our ability to eat as well as we should. In terms of touch, aging reduces or changes our sensations of vibration, cold, heat, pressure, or pain. With an increased sensitivity to pressure, temperature, or pain, we may become more at risk for injury. And persons who are living with diabetes will know that we're advised to always wear shoes just in case we get cut, or to prevent getting cut, because we may not always feel it due to the numbness that may occur as a complication and end up having an infection, losing a toe, losing the foot. Yeah. Effective pain management increases our well-being, our feeling of well-being. Pain is not normal, and it's not something that we should get accustomed to. There's always ways to treat pain. I know a lot of us, we say we don't take tablets, we don't like to take medications, we're not comfortable. There are conventional as well as unconventional ways or natural ways of reducing pain. So whatever works, please try to manage pain, because this ensures how well we feel. Our heart health. The most common changes that occur are stiffening of our blood vessels, which causes our hearts to work harder to pump blood through them. Heart muscles also become thicker just to adjust to the increased workload. These changes increase our risk for high blood pressure and other heart problems. Digestion, structural changes of our large intestines, lack of exercise, inadequate amount of fluids if we're not drinking enough water or if we're not having enough fiber, such as in whole grains, cereals, fruits, vegetables, especially with the skin on, may actually contribute to constipation. Constipation is a common problem with persons as we get older, based on all that I've just mentioned before. In terms of our bone health, regeneration of our bone slows down and with age, and this leads to a lower bone density. So you'll find when you go to the doctor after ages 40 or 50, you'll have to do a bone scan to find out your bone density, which is very important. Many of us end up developing what is called osteoporosis, where our bones become weaker and are softer and are more prone to fractures. Osteoporosis mainly affects the bones of our wrist, our hips, and our spine. So for persons, we may find that if we're not maintaining good posture, we may begin to curve slowly but surely, and it changes the way we're able to stand upright. So it's so important to train ourselves from now and maintain strength of the bone, which can actually be done by good levels of vitamin D, which comes from the sun. We can have vitamin supplements, and with treatment and lifestyle changes, our bones can be strengthened. We encourage you to have more calcium-rich foods, such as milk, cheese, yogurt, or if that's not a part of your diet, like I said, there's also calcium supplements.
Yeah, I was just gonna ask about those who are allergic to milk and stuff like that.
Right.
Yeah.
And there are options. Now we have almond milk, we have banana milk, we have pistachio milk, we have vegetable milk. So no one has any excuse not to have enough calcium intake. Risk factors for osteoporosis include genetics. This condition runs in families. So if persons before you, your parents or grandparents, you notice that change in their posture and the effects on their bones, it can happen to you. You are at risk. Hormonal changes, smoking, low calcium intake, high caffeine intake. A lot of us like our coffee. We may like Coke. Hey. A lot of pop, a lot of soda pop have high contents, such as Mountain Dew, as well as chocolate, and high caffeine levels can soften the bone over a period of time. In terms of our foot health, our feet do change with age. Decreased collagen production causes our soles to have less cushioning and soreness after walking, as well as there is a development of corn and calluses on our feet. We are encouraged to see a podiatrist at least once a year, and if we're having any problems in terms of pain to our soles or our feet, we can have insoles made, special shoes made or insoles created to enhance comfort. A lot of persons complain of pain from arthritis, which affects our hips, knees, feet, or toes. And we encourage persons to maintain a healthy weight because this eases the pressure on our joints. Hammer toes usually affect persons who wear heels for many years, where you have an abnormal bend in the toes. caused from ill-fitting shoes over many years. In terms of foot health, especially if we have chronic illnesses such as diabetes, which can affect our nerves and circulation and foot health, wearing comfortable shoes with good arch support and shock absorption are also great options. Our urinary tract, our kidneys become less able to remove waste from our bodies, and our bladder loses its ability to store urine after becoming less elastic. This increases our need to pee more often. Weak bladder muscles also make it difficult for us to empty our bladder completely or control the flow of urine, so we end up with urinary incontinence, and this affects both men and women. For men, it's further compounded by an enlarged prostate, which presses on the urethra, which is the tube that goes from the bladder out through the penis. And this pressure, usually with the enlargement, a lot of men don't have prostate cancer. It's just an enlarged prostate. A lot of men don't, they see the changes in the ability to empty their bladder or pass urine, but because of fear of having a prostate exam, or if the doctor says it's enlarged, there's so many ways to deal with it. Sometimes doctors insert a catheter or may use a condom with a catheter to pass urine, and the bag is hung on the inside of the pants. For urinary incontinence, because with the enlarged prostate, it's difficult to empty the bladder completely, so there may be dripping after a man thinks that he's finished passing urine. And so it's important to wear incontinent pads or pull-ups or Pampers, adult Pampers. They have some really nice designs now that fit just like an underwear, so that it absorbs the urine and it doesn't cause a scent or an embarrassment like wet clothing. Other factors that may contribute to incontinence include being overweight, nerve damage from diabetes, certain medications, again, caffeine and alcohol consumption. Yay, our sex and sexuality. Our sexual needs and performance may change. And I get excited because I've been doing sexual health for a number of years, and a lot of us don't understand that our sexuality begins at birth and it ends at death. Chronic illnesses or medications may affect our ability to enjoy sex. A lot of men are very afraid to take antihypertensive medications because there is a myth that this is the main cause of impotence or erectile dysfunction, not realizing that if you are prescribed medications for high blood pressure or diabetes, control will actually prevent erectile dysfunction. So erectile dysfunction can actually be caused by the disease itself or from the medication, the side effect of some of the medications. And that's why when doctors start you on a medication, he usually gives you a period of observation to see how it affects your body and if it works for you. As we age, the older we get, we're often viewed as asexual, which is a stereotype for older persons, no longer being able to enjoy or engage in sexual intercourse. And if our children or grandchildren ever know that we're having sex, we are perceived as sexual offenders. It's actually, we're looked at as criminals, like, how could you? When, like I said, these are myths, these are misconceptions. And a lot of times we internalize them, we believe them, like we're not supposed to be doing this at this stage in life. And so we're unable to actually have a desire or actually perform. Many older women express freedom, lack of worry regarding concerns such as childbearing, but forget that the risk of sexually transmitted infections exists. I remember working in the National Sexual Health Program for from 2009 to 2012. And 2010 was such a peculiar year because we'd usually have younger persons testing positive for HIV. And majority of our new cases were women over the age of 60, because the freedom of having sex, and the other thing too is that most men peak in experience their sexual peak between ages 18 to 21. Most men continue to engage in sex, and the benefit of having sex is that the more sex we have, the more we want to have sex. But for women, freedom that comes over the age of, say, 40 to 60, allows us to attach without boundaries and without protection, and therefore increases our risk for sexually transmitted infections. And those such as HIV and herpes and hepatitis B are incurable. So we've got to be very mindful of 1 and 1 equaling 2. In reality, as opposed to the myth that I mentioned earlier, many older persons find greater sexual satisfaction than when younger, with fewer distractions. There's no longer children to interrupt or grandchildren. There's more time on our hands because most of us are retired by the age of 60 or 65, and we have more privacy. There's no worries about getting pregnant, and we have a greater intimacy, or should have greater intimacy, with our life partner or companion. The National Social Life, Health and Aging Project indicated that 72% of men and 45.5% of women ages 50 to 72 reported still being sexually active. The National Survey of Sexual Health data indicates that 20 to 30% of individuals remain sexually active well into their 80s. Yay. However, sexual issues that seriously affect our enjoyment of healthy sexual relationships include: 1, chronic illnesses such as arthritis or joint pains. I mean, if you're having pain, we're not going to be able to move as much as we want to or be comfortable, because the pain usually overrides our desire for pleasure. We may have diabetes or high blood pressure. We may end up with erectile dysfunction. We may have heart disease, and so we can't put the heart under too much strain. And that's why a lot of men are fearful of taking pills such as Viagra or Cialis, because that increases heart rate, improves circulation, but it can cause the heart to shut down. We may have difficulty in achieving orgasm, both for men and for women. Some of us may be affected with a stroke where we have partial paralysis of one half of our body, and so we're unable to actively participate. Some of us may have dementia, and this can actually cause inappropriate sexual behavior because persons are forgetful, they're not sure what they're doing, and not able to control their thought process. In terms of sex, hormonal changes, disabilities, surgeries, medicines, or basically or simply our body image and how we feel about sex may affect our participation or performance or enjoyment of it. Having lack of an available partner, there is currently a ratio of 2 to 1 when it comes to female versus male. Globally, re-availability of women to men by age 40. And this is usually because older men pair with younger women after becoming a widow or post-divorce. Whereas for many of us as women, we opt to stay healthy because it's not just a lack of available men, but we might not be compatible with certain types of men for different reasons. Menopause. For women, menopause usually begins around age 45 to 55, and we may be perimenopausal earlier. So some women may find that they're having changes that fall under menopause from ages 30 or 35 years of age. Menopause usually lasts for approximately 7 to 14 years. True menopause, or actual natural menopause, occurs exactly 1 year or 12 months after a woman's final menstrual period. So once you stop seeing your period and you count exactly 10 months, you go into natural menopause. You naturally transition into menopause. So if we don't want to get pregnant, we usually advise women to continue using contraception for at least 1 year after their last period. Menopause can actually be triggered by having a total abdominal hysterectomy. If we take out not only our womb and our cervix, but our ovaries, which actually control our hormones, we go into instant menopause. And so doctors usually provide treatment for women to fall back on to transition smoother, because it can be instant and it can be very traumatic or horrific. Based on changes in hormonal levels, relative changes occur during menopause. So I did mention or explain earlier melasma, dark pigmentation of the skin, certain points on our body. Changes in our monthly cycles where periods become irregular. We may have spotting, which is just unpredictable. Our periods may last longer or last shorter, and we may have less bleeding or more bleeding. Changes exist. There's a change in our body shape and our energy levels. If our tummies become a little bit more enlarged, we're going to find that we're not shaped as well as we probably did earlier when we were younger. We have weight gain, and this weight gain we find is harder to lose than before. Hot flashes is a common occurrence for women during menopause. It's a sudden feeling of heat in the upper body or the whole body, with flushing of the face, with the neck becoming red, and there's blotchiness on the chest, the back and arms, followed by heavy sweating. So when you see a woman fanning and just like, oh my God, I'm dying, I'm burning up, she's usually having a serious hot flash. And some hot flashes actually coincide with shivering. You become cold. Some persons may have it mild. Some of us may have it very strong, strong enough to wake us up at night with drenching night sweats. The sheets may be soaked because we are saturated in sweats. Most hot flashes last between 30 seconds, which is very short. For me, when it comes on, I feel a heat or a burning in my neck and face, thank God, fingers crossed, and I'll count and breathe, and 2 toes, it's gone. For some women, it lasts longer and it's much more severe. I'm not sure. Things may change for me or it may not, but for now, this is where I'm at and I'm giving thanks. It may last 30 seconds to 10 minutes, can occur several times an hour. It may occur a few times a day or once or twice a week. So it varies for every woman. Lifestyle changes are usually considered first before medication. So we encourage you to lower the room temperature wherever you may be, especially at night when you're going to sleep. Drink small amounts of cold water before bedtime. Layer the bed. Some women have drenching bed linen, and so we say layer it so that you have a vinyl mattress pad over the first layer of sheets so that if you drench in sweat, you can remove that sheet, the pad, and then go again with the layering of the bedding when necessary. Use a portable fan when hot flashes strike. Avoid alcohol. Avoid spicy foods. Avoid caffeine. Quit smoking. Try to maintain a healthy weight because we find that persons who are more overweight tend to have more frequent and severe hot flashes. Engage in mindfulness activities, just as was mentioned before. I focus on my breathing and just try to stay calm during the experience. Vaginal dryness causes sex to become very uncomfortable for women during menopause, and this can be easily addressed by the use of water-based lubricants such as aloe lubricant, vaginal moisturizers, or hormonal treatment. Urinary incontinence is also an issue for women where we have a sudden urge to urinate, or we may lose control of our bladder, and so we end up spilling, especially when we're exercising. If we're sneezing, if we're laughing, if we're coughing, we may have an oops accident. We encourage women from even before, as soon as possible, to practice Kegel exercises. These are exercises where you squeeze your bladder muscles, just as if you're holding your pee for a few seconds, multiple times a day to strengthen the muscle and give it more control. But if we find we're still doing that and there's no remedy to the mess, like I said, there are undies that we can wear that can catch the spill. Postmenopausal women, these are women who are past menopause, it's already done over with, are more prone to develop heart disease, as well as osteoporosis, which is softening of the bones that was mentioned before. It is therefore important for us to eat healthy, stay active, and ensure we have as much calcium in our diet to maintain the health of our bones. Erectile dysfunction, also called impotence, is a concern not just for men, it's also for women, because most men are in partnership and it may take longer for a man to achieve an erection it may become difficult to, after you get an erection, to maintain it, or if you have an erection, it may not be as firm or as hard as before. It may be softer than usual. We are encouraging men, if they're having this this situation, to see a doctor, because it may be a sign of an underlying health problem. Kegel exercise can also be practiced by a man holding his urine, trying to retain his urine to build his muscle. Many factors, in terms of erectile dysfunction, there are remedies for it. Viagra or Cialis, doctors usually start with the pills that enhances blood flow to the penis. All is not lost. There is the pump that a lot of men can use to get the penis very hard. There's a gel that can be rubbed on when he's ready to engage in sexual intercourse. There are implants that a man can put in, one that can be operated from the outside, and some that are he can control when he wants to get hard. And this has helped to save a lot of marriages where couples are able to engage in sex without feeling discouraged or turned off because of erectile dysfunction. Many factors influence how we age. Some are within our control, most are not. Our lifestyle is considered to be a key player in the improvement of our quality of life. I have a friend, he is a fitness instructor, and he said that growing up from childhood, he saw his father exercising at home in the house, stretching, building his muscles, jumping, running, kicking, doing all sorts of stuff. And he said his dad is now over the age of 80 and is still able to move and flex because he has built that momentum and maintained his physical activity in terms of his muscles, joints, everything. He's still as strong. So like I say, a lot of it is in our control, some of it not. Attention to all areas is therefore important because God made us whole, but he also made us multifaceted. So we have the spiritual element, we have the physical, social, psychological, mental, emotional, financial, academic. There's so many different parts to us. And usually when one is out of sync, it affects all the others. It's very easy for it to affect all the others. Mentally, stress is inevitable. It's an inevitable factor of life. And at this stage in life, we all know stress is going to come hell or high water. We're going to experience stressors. How we respond to it makes a difference. Some of us may deny it. I'm not going to give any thought to it. They deny it, but not realizing that keeping it in or ignoring it usually still affects our health because it has an effect on our blood pressure. It has an effect on our thinking without us even thinking about it. It's there, we know. And some of it we can address, some of it not, because the only person that we can change is ourselves. And the serenity prayer is true. We want God to give us the strength to do what we can do, courage to do what we can do, peace when we can't, and then wisdom to know the difference. Effective communication, I would always encourage, because learning and unlearning is a lifelong process. It's important for us to remember that self-management is key, mastering ourselves and not suppressing our feelings, because it's important for us to be authentic in our relationships and our attachments. We have to honor and be honest with and be true to ourselves and as well as to others. Be true about what we think, how we feel, respecting ourselves first, and then the rights of others. All of us have rights, and with those rights come responsibilities. It's a very delicate balance to maintain, but it can be achieved. It is okay to ask for help, especially when critical issues are beyond us, such as abuse, depression, anxiety. We have had, for us in the Virgin Islands, we have had Hurricane Irma, which was a Category 5, some say 6 hurricane. It was the most catastrophic occurrence in our territory. It completely devastated our country. We're back up on par, not as where we were before, but we're doing better now. But that took a toll on a lot of persons' psyche because they lost their homes completely. A lot of persons lost family members to death. And then we recovered from COVID. We recovered from Hurricane Irma and then entered into the COVID pandemic globally, internationally. We lost persons who were close to us. A lot of us got sick. It was a challenge being on a lockdown. You had to deal with being at home, not being able to be free to go out, enjoy nature in some countries. And some things are just beyond us, but it is important for us to engage in mindfulness techniques. I find they help a lot. Yoga, reflection. Each day we reflect on the day and we give thanks. We give thanks, not just when we are worshiping, but throughout the day. Father, thank you. Thank you for the near misses. Thank you for health. I love to thank God for health, strength, and sanity because it's a blessing that we take for granted, but being sane is critical. Meditation works, and some persons aren't in favor of meditation, but meditation is basically just clearing the clutter in our minds. It's focusing on the now, staying present, listening, observing, and not allowing thoughts to bombard our minds. And I find meditation helps in terms of our focus, our concentration, our sleep, our mood, and a lot. Exercise, I go walking for at least half an hour every other day. And exercise helps with our mood as well. Gratitude, giving thanks. Like I said, I have a gratitude journal where I write down. So I can see over the past few years on a given day, at the same time this year, last year, this time, I was giving thanks for this. And look how far I've come where that is concerned. So that increases our gratitude. Music helps some of us to stay calm. And all that I've just mentioned enables us to stay still, be present, listen, observe, improve our aura, our energy, and our vibration. And you'll be amazed to know the energy field that you maintain. It either pulls people in or it pushes people out. And it's a very powerful part of us that we don't usually acknowledge, but we have to pay attention to. As within, so without. Socially, we may find ourselves at this stage in life looking at others who may be worse off than us, including those of our peers or family members who have died or maybe in a nursing home. And some of us may become more depressed, like, oh my goodness, I wonder if this is going to be me. Or some of us may end up feeling more positive for where we're at right now. We were the same age, born the same year. And I'm sorry to know that they have deteriorated or they may have passed on, but I'm grateful that I'm still here. We all accept that there may be some deterioration in our health, and so we're able to better adapt. Maintaining positive social relationships and having a great sense of humor contributes to our overall life satisfaction. It's not only wonderful to laugh with others, but to laugh at ourselves. Humor yourself, just not overdo it in terms of laughing at everything, but just stay in a jovial attitude. Transition planning is very critical at this stage in life if we haven't done it before. We may be 30, we may be 40. It's important that we create a will if we have assets. We may want to issue a do not resuscitate or a resuscitate order, just in case we have a heart attack or any physical illness that takes away our mental ability to make decisions. We want to know if we want to give the permission for the doctors not to resuscitate based on your quality of life or to do so. We may want to be cremated. How many of us have thought about that? Or how many of us are planning our funeral if we want to be buried? These are things to consider, and these are things to start preparing for, because end of life is a given. The Bible says that it is appointed unto man to die, meaning that we all have an appointment with death. We all have a date and a time, and when that ticket comes, Hezekiah was able to ask God for a few more years, but at the end of the day, for the rest of us, we're going to have to transition. And hopefully when we do so, we are ready. Nutrition, like I said, pay attention to that because healthy meal planning is necessary for, see, I haven't even changed the slide. Being caught up in talking. It's not moving though. I'm not sure why. Okay. Great. Nutrition, healthy meal planning is necessary for us to maintain our mental acuity It helps us to resist illnesses and diseases, boost our energy levels, improve immune function, enable speedy recovery if we become sick, and manage health problems more effectively. We should strive for at least 50% or half of our plates being fruits and vegetable, quarter being whole grain, and 25% being rich in proteins such as nuts, beans, fish, lean meat, and poultry. And having a fat-free or low-fat dairy products such as milk, cheese, and yogurt, like I said, now a lot of it is being made from organic sources, vegetable sources. So we have an ability to maintain our nutrition. Exercise, as was mentioned before, improves our quality of sleep and our heart health. And exercise enables us to better manage chronic diseases such as diabetes, high blood pressure, high cholesterol. Even light exercises such as stretching, taking short walks can work. The focus should not be on intensity as much as it is on consistency. Some of us, we put in a hard routine today and then 3 months later, we're sedentary, was just getting distracted with so many issues in life, and then we go again another 3 months. It's important to be consistent, and I've proven that it maintains heart health, it maintains our weight, it improves our focus, our concentration, our vibe, our aura, our mood, our energy. It improves everything. I'm going to stop here. I want to thank you for your time. Thank you for your attention.